Welcome, everyone. Welcome, welcome. Hello, Betty. Hi, Cicely. I see you. Hi, Jamie, Catherine. Shout out to
Welcome, everyone.
always wanted to say that. Hi, Mom. Her name's Susan, if anyone wants to direct message her and ask her for some good blackmail. Hi, Laura. All right, looks like we have a few.
Hello, good afternoon. I'm sorry, mute eluded me. Good to see you.
That's all right. Mute eludes the best of us sometimes.
Is that Raja?
It is, and she just decided to start chasing the cat. So I'm going to escort the cat out and introduce everyone.
Tell her grandmommy said hi.
Okay, I will. Raja, your grandmother says hello. All right, hello. Welcome to Fostering Anti-Racism and Equity in Mental Health Services and Systems. We're glad that you're all joining us today. My name is Yasmina, and Dr. Freeman Foster and I are very excited to welcome you. Next. The National Training and Technical Assistance Center for Children, Youth, and Family Mental Health is funded by a 5-year grant through the Substance Abuse Mental Health Services Association of America, and the views presented today do not necessarily represent the views of the government. Click. Dr. Freeman Foster does have a really good art background. Session security. So this is just to put a disclaimer out for safety, because there has been a history of Zoom interruptions. In the very unlikely event that that happens, just know that we are working on it behind the scenes. We'll immediately end the session, and we will send you a follow-up email with instructions on how we plan to reconvene. Next. So who are we? Who is NTAC? We are a technical assistance center that serves to provide all children, youth, and their families with the supports and services they need to be healthy and well. And who are we? My name is Yasmina, and I am a former state director for the Arizona Department of Education, which in the Department of Equity, Diversity, and Inclusion. And my unit included a state suicide prevention project that some of you might be familiar with called Project Aware, as well as a school safety program that put school counselors, social workers, and school resource officers into school classrooms across, I think now 400 schools across the state of Arizona. And spent my career in mental health. So I call myself an accidental educator, mental health professional by training. I'm very excited to be here, and I will pass it over to Dr. Freeman Foster to introduce herself.
Thank you so much, Yasmina, and welcome everyone. My name is Dr. Tanisha Freeman Foster. I am with NTAC, and I serve as the Equity and Cultural and Linguistic Competency Specialist. My background consists of working with individuals who are involved in the child welfare system, who have been involved or impacted by HIV and AIDS, also with mental health and substance use. And I have always had a passion for creating equity within programs, finding innovative ways to engage with individuals in our community and helping them get the services that they need and deserve in the way that they choose to receive those services. And so equity is my baby, and I'm very excited to be a part of this presentation today. So I'll just discuss our learning objectives. We have 3 for today. So the first one is that our goal is to enhance your understanding of the difference between what it means to be a non-racist organization versus an anti-racist organization. Also, our goal is to enhance your understanding of the functions and impacts of racism and inequities in the mental health services, organizations, and systems. We also seek to assist all of our participants today in learning and sharing actions and strategies for fostering anti-racism and equity in mental health services and systems. So our goal is to increase the understanding and also come away with some strategies of things that we can do and some important and critical questions that we can ask as we implement these strategies within our programs, within our organization's culture, and within the communities that we're working with. So next, I just want to ground us that today, and anytime we're talking about things that may be sensitive, things that require us to talk about equity, we also have to talk about power. And when we talk about power, we talk about privilege and we talk about racism. And so one thing I want to say is that language matters. And I know when we were younger, we used to hear that sticks and stones may break my bones, but words will never hurt me. We now know that words sometimes hurt more than the sticks and stones. And so we just want to ground our session today with the following tenets: that we will use language that is strength-based and hopeful, that we will ensure that our language is inclusive and accepting of diverse cultures, genders, perspectives, and experiences. We want to come and view things from a healing-centered and trauma-responsive lens. We also invite you to join this presentation today in this partnership and thinking around this topic where you are in your own journey. And so we acknowledge that people have different places that they're at. Some people have been doing equity work for years, some may be just starting out, and we honor all of that because we all have things to learn and we all have things to share that can be helpful in moving the needle forward in this topic. Also, we want to make sure that we use person first language that is free of labels, that we come from a lens of non-judgment, and also we avoid assumptions, that we make sure our language is respectful, clear, and understandable. And last but not least, that we ensure that what we say aligns with what we're doing, so that our words are aligned with our actions and our policies and the things that we are producing within our organization. So Yasmina, I will turn it back over to you to learn more about who's here with us today.
So I'm excited to lead you all in the following activity. For some of us across the country, I have discovered that this is a new thing. And in other parts of the country, there is debate about whether non-Native and non-Indigenous folks should be doing this following activity. So I just want you to know that even within the realm of equity work, there is still ongoing discussion and debate about what we choose to do and how we choose to do it. And part of engaging in that dialogue is being willing to have those challenging conversations. So in the chat box, if you have access to the chat box, I would invite you to share your name, your location, where you live, and the native lands you are on today. And in Arizona, we call this a land acknowledgement. So typically when I open my presentations or webinars, I begin with an introduction of myself. And I say that I'm joining you today from the ancestral homelands of the Maricopa P.A.U.S.E and P.E.P.A.U.S.E Indigenous peoples, commonly known as Phoenix, Arizona. If you're not sure what native lands that you are residing on today, you can use the link that Joanne dropped in the chat box, and it will take you to a map that will show you the historic overlap of Indigenous peoples who maybe have lived where you are today. Welcome, Diana. Welcome, Rosemary. Using the reaction buttons, and the reaction buttons, if you're not familiar with Zoom, at the bottom of your screen, how many of you are familiar with a land acknowledgement and see it frequently in your practice? You can do a smiley, a rainbow. I got a thumbs up and a heart. About 4 or 5 of us, 6. That's good. I'm so glad to see that they're catching on. Awesome. I'll pass it back to you, Tanisha. Go ahead and continue filling in the chat box.
Awesome. Thank you so much, Yasmina. And so one of the reasons that we do that is that we acknowledge the lands that we are on. And that's important when we talk about equity, that it's hard to go and establish where we would like to go before we first understand where we are at and where we have been. That all of those things help to make equity, and it should be incorporated in the work that we're doing. So we want to channel your imagination for this presentation. So this letter, your organization just received this letter. And the letter is from your largest funder. And it says that you must immediately demonstrate equity in every aspect of your organization. It says that staff must reflect the diversity of the communities being served, and that it must be present within all levels of the organization, not just the bottom, not just the middle, but entry-level positions to middle management to senior leaders in that organization. Also, the letter says that services must be led and reflective of the community's voices and choices. And so you have to bring people from the community to the table, and they determine how services will be provided and what those will look like in their communities. Third, it says that you have to ensure equitable access to services regardless of the individual's geographic location, insurance status, and outcomes must demonstrate success across all groups. And so again, we're looking for inequities and we're looking for ways to reduce those inequities. Also, that positive and equitable outcomes are required. And so the caveat to this is that the funder will be checking on you and they will be reviewing your progress and they will be making determinations on an ongoing basis every 6 months. And for individuals and grantees who are not complying with these requirements, they will lose their funding. And the funder will replace those grantees with other organizations who can meet these goals. Losing this funding will result in the closure of your organization. So what will you do? Any thoughts can put into the chat. Class, I see that. Thank you for sharing that, Maria.
Maria, do you mind defining that acronym for our friends? I think it's a cultural linguistic. Oh my gosh, I'm gonna have an acronym blank just because there's so many people here right now.
Somebody said cultural and linguistic appropriate services.
Thank you, Maria.
Awesome.
It's funny because I just helped provide a training on those a couple of weeks ago. I should definitely.
It happens. It's Friday, so thank you. So now we ask you to fasten your seatbelt and we're going to take a ride into the future using that scenario. And so one of the things that we are going to do is first create a shared understanding of the terms that we know. A lot of times within organizations, we say these fancy words such as equity and inequities, and people have their own perception and their own ideas of what this means. And so step one is creating shared terms. Like as an organization, you've come together and says, this is what equity looks like. And this is what it does. Because a lot of times we'll say, this is what equity is, and we leave it like that. And you go to a website and it'll say, this organization believes equity is this. And it's just stuck on that website. It's stuck on a piece of paper. But we want to make sure that whatever we say, if it's diversity, if it's equity, if it's inclusion, if it's liberation, that it is and it does. So it is this as defined by our organization, and it does this as defined by what it does within the individuals who are receiving services in the organization and also amongst the staff. What does it look like? What does it feel like within that culture when we say we have agreement around these terms? So for the purposes of this session today, we're going to look at health disparities, which are a higher burden of illness, injury, disability, or mortality experienced by one group relative to another. Health equality means giving everyone the same resources regardless of their needs, challenges, barriers, and circumstances. Health equity is the state in which everyone has the opportunity to attain full health potential. No one is disadvantaged from achieving this potential because of social position or any other socially defined circumstance. It requires that those with the worst health and fewer resources receive more efforts to improve their health. And that's our goal for this particular session today. As we move this forward, liberation is our ultimate goal, where it requires us to dismantle systems that perpetuate oppression and allowing those who are oppressed by the systems to lead the change. This requires innovative thinking and also shared power. So why does it matter? And I'm not going to read this bullet by bullet, but why it matters is because inequity is making us sick, that we see that ethnic and racial minorities often bear a disproportionately higher burden of disability resulting from mental health disorders. We also see that approximately 50 to 75% of our youth in the juvenile justice system meet the criteria for a mental health disorder, and most of them are BIPOC youth, which stands for Black, Indigenous, People of Color. Also, we know that racial trauma increases the risk for a PTSD diagnosis. And so we can look at this chart and look at people and individuals in our community by race. We can look at them by age. We can look at them by their sexual expression. We can look at them by religion, and also the racial impact of racism on their lives and how it impacts them. And so from every aspect, we can see how inequity impacts people's health. So this meme is something that we inserted in here because sometimes it just makes things easier to understand. And so we have equality, which we give everyone the same thing. And so you'll see, we'll say in this example that it's a father and two kids, that everyone has the same box, and still the father can see the game, the middle child can see the game, and then the younger child cannot. And so with equity, we give people what they need. The dad doesn't need a box. He's already tall enough and he can see the game. The younger child may need just one box, and the youngest may need two in order to be able to see the game. And with liberation, we like, why is there a fence there anyway? Why can't the family just view the game without having to have any boxes? And so in liberation, we're working with systems, we're working with humans to say, why are these barriers there, and what can we do as organizational leadership in a team to remove these barriers for our clients? We know they want to see the game and they have the means to get to the game. How do we remove the barriers that prevent them from seeing the game? Our next item is creating a shared understanding of terms, and this one is involving racism and anti-racism. And so racism and justice. So we have structural racism, which is the normalization and legitimization of an array of dynamics, which include historical, cultural, institutional, and interpersonal, that routinely advantage whites while producing cumulative and chronic adverse outcomes for people of color. And then we have institutional racism, which is racism that occurs within and between institutions, which result in discriminatory treatment, unfair practices, inequitable opportunities, and impacts. And then our ultimate goal is racial justice. It's the proactive reinforcement of policies, practices, attitudes, and actions that produce equitable power, access, opportunities, treatment, and impact and outcomes for all. And so as we move through this lens of equity, if we reflect back on the original letter that was received by that organization saying that you have to look at equity, one of the things that we can do also, and we'll talk about later on in this presentation, is looking at the data. And so even if you don't think your organization may be racist or having some individuals that are privileged versus others, looking at the data, who's showing up, who's receiving services, and what are outcomes like for those groups. Also among your staff, who's on your staff, who's being hired, who's being mentored, who's constantly being promoted to other positions, and who's being left out. And so looking at things from the big picture and looking at the data, having focus groups with your clients, having focus groups with the staff, and making sure that you're open to hearing what people say, even if you disagree with it. So our next one is, again, another meme just illustrating what it means to be non-racist versus anti-racist. And so we parallel this to a game, a baseball game. And so to be non-racist means that you can sit on the sidelines or in the stands, and it can be done quietly. It involves comfortability and minimal action, and it rests on not committing racial offenses. And so you can say, I don't create or commit offenses that are racist, and I try in my caseload or with the individuals that I work with to do my best. That's non-racist because you're there and you are not participating in this, but no one knows. So anti-racism requires us to get into the game. It requires advocacy. It requires saying, okay, this is things that I do with the individuals that I'm working with, but my goal is to see that everyone that works within my organization, that they are following the same processes, that not just my clients receive equitable outcomes and equitable treatment, but every client that enters this building and every staff member who comes into this organization feels like they belong and feels like they are heard and is a part of the decision making that goes on here. And so the anti-racism requires us to get in the game. It requires maximum action. It requires sacrifice and risk, that we're going to get in the game and we're not going to have all the answers. We're going to make mistakes. We're going to strike out, and we keep moving. We dust our legs off, we dust our knees off, and we keep trying and we keep moving it forward as much as we can. It also rests on lifelong learning, that we know that based on our experiences, that no one knows everything about the experiences of another person. But the more we surround ourselves with people who are different from us, the more we can learn and the more we can share and the more we can take that information and put it into services and make sure that we're doing the right thing by everyone consistently. It also requires us to reflect on ourselves, that sometimes there are things that we are doing and they may be unintentional, but they cause hurt. And hurt is hurt, regardless if it's unintentional or it's unconscious. And so really taking a step back to look at the things that we're doing and say, how could I have said that better? How could I have done that better? How could I engage with an additional community partner to ensure that these individuals have access to the services that they need that are also reflective of their culture? It also requires us initiating uncomfortable conversations with our loved ones, that it's impossible to go into your job and say, I'm committed to equity and I'm committed to being anti-racist, and go home and take that jacket off and sit at the table and have conversations about people who are different and through a negative lens. And so it requires us to stand up. It requires us to be seen. It requires us to take risks and sacrifices.
And a lot of this, Tanisha, how many of us in this room are healthcare or mental health care professionals? You can either use the raise your hand feature or do a reaction for me. Okay, so we got a lot of healthcare. We got, ooh, somebody's clapping for the healthcare professionals. Yes. How many of you in this room are educators? You can raise your hand or use a reaction feature. Educators in the house, hello. So what I really liked about Dr. Freeman Foster's explanation of the way inequities are making us sick is because if we have educators and healthcare professionals in the room, there is a distinct overlap in the social determinants of education as they relate to the social determinants of health. As an educator, we usually know by grade 3 reading levels, long-term life health outcomes, just based on kids' ability to access education and based on their ability to access books in the home, which are often and unfortunately correlated with access to services like access to a library and access to childcare and access to a parent who is home in the evening to read those books. And we know when we look at socioeconomic status and racial ethnicity distributions, that folks who are likely to be working the jobs in the evening are likely to be working more than one job or working a lower paying job that may not make it possible for them to afford childcare. So when we think about the different hats that we wear in every facet of our life, and that's why I really like, if you could go back to one slide, Tanisha, that's why I really like in the picture of the baseball field with the anti-racist and initiating uncomfortable conversations with loved ones, that can be where the real magic happens, because just like those, or not just your loved ones, with your school principals, with your school receptionists. How many of you in here also wear another hat as a parent? There we go. How many of you are so happy that kids are going to get some type of in-person learning and you might get to have a cup of coffee by yourself? How many of you are also still a little scared because there's a lot of politics going on and some of our kids are in schools that may not have protections? Schools have historically been the places where we perpetuate or end systemic racism and systemic oppression, because they also have been the tools of systemic racism and oppression. So I want you to think about all the different hats that you wear, not just as mental health professionals or educators, but as parents, as aunties, as uncles, as spiritual leaders in your community, that the most difficult conversations I've had about equity have been with the people who are in my closest circles. But again, shout out to my mom who modeled for me, having hard conversations is always worth it. And it fosters and solidifies those relationships, and you usually end up learning something. I just tried to click the slide and realized I'm not controlling it. So in order to do all those things, in order to understand where is our role to act, we have to first start with an introspection. We have to first start and examine the messages we have received. A lot of our most critical learning and development happens before age 5. And those memories and messages are not something that we are always consciously aware of when we have an action or a belief as an adult. So one way to look at this, and we broke it down for you, childhood message, people are lazy. Or how many of you have heard the people on welfare who have a brand new cell phone and a really nice fancy purse? They're actually lazy or misusing welfare, right? This is something that I think it just becomes like this common perpetuated message. So that influences the beliefs that people are choosing to misuse their money, that they're choosing to, instead of buy food for their kids, that they're choosing to spend money on these really expensive items. And that if only they could manage their money better, then they just wouldn't be poor. And so they don't need those social programs. When the reality of the situation is that poverty is much more complex. Poverty and social class are not just how hard you work, because we know and we have seen that when the starting line isn't the same place, that how hard you work is sort of irrelevant if you have a race to run that's twice as long. And when folks who aren't using those social programs are placing value on the worth or the acceptability of using social programs, then it influences whether we as voters, we as systems leaders, are going to continue to fund them. So those of you who are in positions, and that's why this exercise is so critical, to understand our own biases before we start to take that adventure that Tanisha's leading us on. As our professional hats, we have to take a look at what is underneath and what we bring to our conversations, to our programs and policies, and to our interactions with our students, families, or clients if you're a mental health professional. So how do you do that? That's hard, because we're bombarded with messages literally from the minute we can take in visual information. They've done research that shows that fast food companies aggressively target kids in the birth to 5 age, because that's when you form those memories and those connections and those good feelings to those fast food organizations. A lot of people can't define why they like a McDonald's Happy Meal. And I used to like to go there, as my mom will tell you in the direct messages, just for the toy. And I never ate the food because I wanted to go to McDonald's for a different reason. I received a message that that's what was cool and that's where the toys were. Imagine that perpetuated, except about something that's so much more taboo: race, ethnicity, class, income. So how do you start to look at it? You, swish. Get to the roots. You look, I thought we were gonna pause next. Haha. No, first you get to the roots. And you look, what stage of change am I at? What is my sphere of influence? What do I have to lose? Because knowing what is at risk is also one of the common messages that, as a person with white passing privilege, right? I'm a halfie. I hear, well, now is not the time to rock the boat. So you'll see down there at the bottom of the side, you'll see maintaining status quo. Or we'll see that privilege comes into place in places we don't know. One of the things that we often don't realize is all the places that our privilege comes into play. There's a, we can send it in the follow-up email. It's called Unpacking the Invisible Knapsack. And you think about all the different places where your privilege. It could be your ability or disability. It could be your neurotypical ability or non-neurotypical ability. It could be your privilege with your ethnicity, gender. If I turn on the television, I'm likely to see someone of my race, ethnicity, gender, ability represented. If I go to a store and I ask to speak to the manager, is the manager someone who's likely to look like me? Or is the manager someone who's likely to be from a different race or social class? If I need to speak to a teacher, are they going to speak my language? If I need to find a therapist, are they going to understand my religion? And a lot of times, when we're working in communities and systems that have been predominantly driven and controlled by the dominant majority, we see a lot of what is called ignorance. But ignorance is not always an excuse. Actually, no. Ignorance is not an excuse. And this is where we have the ability to educate. We have the ability to provide access to information. And those of us with privilege or white passing privilege or whatever privilege we have can take up that cost because our colleagues, family members, friends, community members who identify as Black, Indigenous people of color are tired. They have experienced impacts of the COVID-19 pandemic at widely disproportionate rates with widely differing access to healthcare and mental health care. And so what is really empowering and inspiring to be an ally is to be able to make that transition from I'm just not racist because I'm not participating in these behaviors, activities, and ignorances to anti-racist, to I'm doing something to actively become involved in my own community in whatever hat I might wear. So I don't want you to feel like leaving today that you can't make change just because your title doesn't say director, or just because you don't supervise a team, or just because you don't manage money. Many of our greatest leaders didn't do any of those things. And sometimes it's a small act of resistance and self-education that can make large differences, which starts with, now here's my slide, pausing, the pause model. And I believe, I do get to do the pause model. Okay, so the pause model, and when I first learned this from Dr. Freeman Foster in a really great series that we're actually, I think you are actually hosting a second session of Bold Conversations.
Correct.
If this is of interest to you, I highly encourage you to look up the Bold Conversations community of practice, because when I participated in this last semester, we spent a whole learning series unpacking the different scenarios. So the pause model asks us in different situations to pay attention to what's actually happening, acknowledge our own thoughts and emotions related to what's going on, understand that my viewpoint and other people's viewpoint, reactions, and interpretations of what I'm going to say may differ, search for the most empowering and productive way to handle the situation, or as my mom would tell me, you don't have to get out your soapbox every time you want to talk to somebody. That's not always helpful. And then enact your plan and proceed with a decision. So I'm going to give you a little scenario, and then I think Dr. Freeman Foster will give you one as well. So in the workplace setting, one way that this can look is for a new employee starts and they're approached by another colleague, and without really knowing each other, they ask, are you able to translate this document into Spanish? This person has to pause and think, why are you asking if I can translate this into Spanish? Was this inappropriately listed on my application? Or is it because I came from a high school that had a high Latino population that I may have learned to speak Spanish at some point? But we haven't met, and I'm not sure why you're asking if I can translate a document into Spanish or not. So in that situation, in a professional setting, just asking a few follow-up questions. When did you need this by? How good of a translation did you need? Turns out I don't actually speak Spanish, and there was some assumptions made. And when you can have a non-confrontational, just exploratory conversation and encourage folks to confront their own, gently confront maybe some of their own perceptions, and then you just can leave it there and enact with your plan and proceed with my decision. Like, no, I'm actually not comfortable to translate this document. because I don't have the type of skills that are needed, and I'm happy to connect you with some translation services. How many of you have witnessed in your role professionally some things that are questionably what we would call microaggressions? Like maybe the person saying them doesn't realize that they're actually rooted in racism. You can use the reaction button. We don't need any personal stories shared. Yeah. How many of you in that moment have felt unprepared to respond? I have definitely felt unprepared to respond. And I think a lot of times, especially if your gender in this group is aligned with female socialization in the United States, I think a lot of times we're socialized to not address things directly because that's part of how we are raised, or how we are raised to be polite, right? So knowing that you are not alone in feeling like you don't know how to respond, you are not alone that it feels uncomfortable and awkward. You are not alone if it doesn't feel like you did it right the first time, but being able to have a model and a method. Yeah, Diana in the chat box, she wrote, definitely can kick into flight, fight, or freeze mode. I can feel it sometimes when I see it happen and I know I need to say something. I feel that too. Yeah, that doesn't go away. And I'm gonna pass it back to Tanisha. I really also like a scenario she shares. I'm hoping that she shares it today as well.
Yeah.
Okay.
So I would say, I mean, this shows up in various different ways. And I think, thank you, Yasmina, for sharing that example. And I think the goal is to think of these examples, but also think of the impact. And so, for example, there may be that your organization provides home-based services, but you refuse to go, you have a coworker that refuses to go into certain communities because it's deemed to be dangerous. And so the pay attention to what's actually happening beneath. So we'll start with the P, like, uh-oh, I just got this new client and I looked at the address and I Googled it and it's over there in that neighborhood. And so we start sweating and my heart starts racing. I start getting nervous about that. So the A is acknowledging my own thoughts and emotions. Like, why am I feeling this way about this? Why am I nervous about this neighborhood? And it may be that I seen something on TV or that I was just told by a coworker when I first started that neighborhood over there, that's a bad area. And people over there, they don't care about their life. They don't care about their children. And so we don't go over there. Or when we go, we wear tennis shoes instead of our regular work shoes, just in case it goes bad and we have to run away. And so now all these things are coming into play. Or I grew up hearing certain things about people who lived in those neighborhoods, and I didn't go to school with any of them, and I don't know them. And so now I'm just bringing and transferring those things that I heard and those judgments onto this community without even knowing the people who live there. So my U is understanding the options for other possible reactions and interpretations. So if I pull back and I look at this community is no more dangerous than any other community. Like, there's not data, there's not stats that show this is a dangerous community and everyone goes in, they get held hostage or killed. Like, it's not that type of community. There are people who are different there and they live different than maybe the way that I would live. And some of them do not, just like any other community. And so it's unlearning that story and unpacking that story. And then the S will be searching for the most empowering and productive way to handle the situation. If I do not go into this community to visit this family, there's a mom in that house that I need to see. And she is home with her kids. She's doing homeschooling. And if I don't go there, she will have to take multiple buses to come to the office to see me for services, which may impact her medication management services. It may impact the therapy that she receives. It may impact other services that she receives as well. And so I have to look at this person from a positive lens. First of all, they are reaching out for services. They are requesting to receive services. And so I have to give them credit for that they may want to do better, and they are making the first step. And so I need to meet them halfway. And if I go back and I look at my organization's mission and vision, that's what we're about. We're about giving hope, and we're about helping people be their best selves. And so I have to make sure that that's showing up in my choices and in my thoughts. And so E is enact my plan or proceed with the decision. So I am deciding that I'm going to go to this person's home. I acknowledge that she is reaching out for help and she wants the best for herself and for her family. And as a social worker or as a caseworker or as a therapist, that's what my work is rooted in. I want the same. And so I'm going to go there and I'm going to talk to her and I'm going to learn about her and not prejudge her because I don't even know who she is. And so that is a part of the pause model, is before acting that we take a step back, because most times assumptions lead to bad decisions. And so me assuming that she is a bad person and having her come into the office and taking that step back and looking at her with my arms folded sideways because I doubt her sincerity or I doubt her ability to do better or to want to do better, like that impacts people. Sometimes it's not just not delivering the services, it's when I come to deliver them, how is my demeanor? Am I presenting through a lens of hope that I believe that she can be whatever she chooses to be, that her children can thrive and be whatever they choose to be? Or am I laying this blanket of stereotypes and stories and narratives that I heard that are degrading and demeaning and racist on this family, that and not even giving them a chance? And so that is the purpose of the pause model. So next is doing the work. So we've taken you through steps of acknowledging where you're coming from first. And we think that that is really a critical step in creating equity. Sometimes we go into this field and we say we want to create equity and we're just going to look at the data and we're going to go without doing the work on ourselves. And so we always want to ground this work in humanity. Although we're talking about systems and policies, those are things, and they don't do anything without people. And so we always want to look at the humanity behind the policy, the humanity behind the system, the humanity behind the organization, because that is the engine. And so if we look at it from that lens, we can all do something. But if we look at it as this thing, like this monster, and we compare it sometimes to the dragon that was on the Wizard of Oz and how they were so afraid to go to this castle, and then they go and they pull the curtain back and it's a little man behind there. And it's like, we could have did some work. We could have did more if we would have knew that this dragon was just a thing and there was actually a man that was operating it behind it. And so that's our goal as we're doing this work, looking at the people behind the policies, the people behind the processes, the people behind the systems, and the people behind the organizations. And most times it starts with us because we are those people, and it builds from there. So the steps that we want to take, and this is connected to, it builds on our 5 Things Digest. And Amy, I believe, put that in, or Joanne put that in the chat box earlier, the 5 Things Digest that this is building on. And so one thing we say is equity requires long-term investment. It requires us to develop a starting point and to take the first step. Sometimes this work, it seems overwhelming and it's like a big ball of tangled up yarn and we don't know where it starts and where it ends. And sometimes it paralyzes us, but nothing gets done if we don't do it. And so we have to take the first step. We have to choose a portion of the string, and whether it's the beginning, the end, or the middle, we just start. Also, we create a culture of equity, not just saying it, but doing it. Equity is and equity does. We ensure anti-racist services are available for all people, that not just we are not racist here, but this is what we're doing to show we are out there, we are advocating, we are supporting, as evidenced by these things that people can actually see, that we are out on the field, we are making mistakes, we are learning, we are falling, we're getting back up, and we're getting back in the game. Also, that evaluation is critical for sustaining anti-racist practices, that we have to follow up. It can't be in our strategic plan in 2022, we're going to do this and we don't check it again to 2023. Like it requires consistency. It requires us checking to make sure we're on track. And if we're not on track, how do we change our action, or how do we involve more people so we can get this thing done? So when we require long-term investments, and these are some of the questions that we will just throw out for food for thought, is that you determine your why. And is this a temporary fad or a long-term commitment to doing and being better? And so we noticed around the time of the deaths of Ahmaud Arbery and George Floyd and Breonna Taylor, there were organizations who had these beautiful, elaborate statements of how they were going to provide anti-racist services, and they were in support of Black and Brown communities, and also with Asian communities and the tragedies in those. There were additional statements released about support for Asian communities, Asian and Pacific Islanders. And so again, is it a fad or is it something that we're committed to? And a lot of times we check that by saying, does your words align with your actions? And also, are you putting your money where your mouth is? Like, how are you funding it? How are you supporting equity? How are you making sure it's there? And how will you engage staff, clients, participants, stakeholders, senior leadership, and board members in this long-term investment? It can't just be one person. It should not just be the director of diversity, equity, inclusion who takes this thing and put it on their back. It has to be everyone, all hands and all feet on deck. Everyone in the organization has a part to play. Also, how will you address adverse responses and actions? And this is important because people are going to push back. People are not going to be comfortable with this. And what happens when you start doing this work and you receive complaints from people who don't want to talk about race, who don't want to talk about privilege because they are quite comfortable with it? And being prepared for that, does it shut down the whole thing? Or we make room for people to do this and distract away from the main purpose? You have to anticipate it and also put a plan in place. When this happens, we're gonna push back and say, this is what we're doing for the greater good of the organization. And we're gonna make space for people to voice their opinions in a way that is trauma informed and that is empowering and not oppressive. But we're going to move forward with this and making that clear to everyone that is a part of that organization. Also, developing a starting point and taking the first step. What does your organization need to effectively foster a culture of equity and anti-racism? And what I've seen is a lot of times people will say, I want to do something around diversity, equity, inclusion. I think we have a problem with this, and I want to learn about this, or we need someone to come and consult with us and provide this training without even fully understanding what's going on. And so when was the last time you spoke with the clients? When was the last time you spoke with staff at all levels to find out what's really going on in that agency? And then you start to theme and categorize those things and say, okay, this keeps showing up. These are our priorities. We're going to work on this first. We're going to work on this second, versus going and just say we need to do a diversity training once a year without even, it's like putting a Band-Aid on a broken bone. It's not going to heal. It's not going to do anything unless you really identify what's going on and make it specific and tailored to your organization. It's bigger than just sitting in a webinar. It's addressing what's really going on in that culture and really going on behind policies. And most of the time, it's not the things that are in the handbook. It's the things that are occurring in the background and underneath in the culture that is being perpetuated that's not written. It's the unwritten culture. It's the silence. It's the body language. It's the inequitable promotions. It's how clients from different backgrounds are being treated. And those things we need to know about so we can start to address them. Also, what do the individuals and communities you work alongside believe your priorities should be? Which is important because sometimes we will hear, we don't have enough money in our organization to survey clients. You don't need a survey. You can just ask them. If you ask your clients, do they feel like they're being treated fairly? They will tell you. If you make it in a way where they don't feel like they're going to be retaliated against or they're going to be penalized, your clients can tell you who are the people who are not providing equitable services or who are the individuals who are providing services that don't feel welcoming or accepting to them. Like they can tell you, and if you ask them and you're truly concerned with the response and you're truly committed to doing something. That's the other thing. What can you implement within the next 30 days? Because otherwise you're just asking people for their opinions and doing nothing with it.
For those of us
Also,
that
go ahead.
the data that's already available within your school system to do some of the assessments. So if you're an educator or a principal, you can look at how discipline referrals are being processed, managed, who's receiving what type of discipline, for how long, for what types of offenses, and really surveying your community about what are their values and what should the consequence system look. And kids are generally pretty fair. They will generally give you usually more serious consequences than the adults will.
Mhm.
Including their voices in the development of those discipline matrices, as well as families, can be really, really empowering and develop a relationship that might not have been there otherwise.
Absolutely. Also, we want to create a culture of equity. What is your organization's definition of equity? And this is important because a lot of times we say we want equity and we assume that everyone understands what it means and that it means the same to everyone, and it doesn't. And so creating a definition or a standard of equity that is specific and tailored to your organization. What is it? What is equity? And what does it do? What does it look like in client outcomes? What does it look like in the services that we provide? What does it look like in hiring and retaining staff? Also, do individuals know what is expected of them? Because if they don't understand the definition, they probably don't know what's expected of them as providers or as therapists or as teachers or as administrators. And how are they held accountable for their actions, behaviors, and words, which is important. If we say this is what equity is, and these are the behaviors that are expected, when people do not meet that, there has to be consequences for it. And it doesn't have to mean that someone gets fired, but we have to say, hey, that's not aligned with where we're going. And there has to be a conversation. There may be a write-up or informal conversation, but there has to be some type of follow-up, or else we never arrive at that place. Also ensure that anti-racist services are available for all individuals. So what opportunities exist for staff to voice their concerns in a meaningful and safe manner? And how often are they asked? Is it just assumed that if no one says anything, that it must be going well? That should not be the case, because most of the time, if people are not saying anything, it means that it's going bad. And so we have to make room to ask those questions, and also show people that we've heard them. And you show them that we've heard them by addressing their concerns and saying, okay, I heard you say this. This is something we're unable to do at this time, but we are not going to let it fall off our radar. This is something we can do, and we're going to do it as evidenced by this, and these actions that we're implementing. And so showing people that they're heard. Also, opportunities for youth, young adults, and families to provide meaningful feedback, again, without fear of retaliation. And how often are they asked when something goes wrong, or when we need a focus group for a new grant and we want to show that we have people participating? Like, how often are people asked? Is there an ongoing box that we can put in the lobby, or we've put boxes in the restroom that people in the stalls where people could put their opinion and we could get their feedback? Is you can create a survey monkey to obtain feedback from people. Also, who developed the client assessments, the evidence-based practices and protocols that are currently used by your organization, and are they culturally appropriate and relevant? Because sometimes we'll pull the layers back and we'll find that this particular evidence-based practice is not even normed with individuals from diverse communities, and it does not meet their needs. It's asking them about things that do not matter to them, or are not of importance to them, or not even applicable. And so we want to make sure that clients have choices in their care and that they know that they have choices. Also, evaluation is critical, and we spoke about this. For the sake of time, I won't read it word for word, but making sure that we have set goals. Where are we at? Where would we like to be in 30 days, 60 days, 90 days, 6 months, 12 months? And who's in charge of that? And it should be everyone. Where is it written? How will we monitor it? Who's responsible for monitoring? How will we share the information back to the people that we ask for information from, and saying this is what this is what should be happening, and then also receiving feedback from them regarding, is it really happening? This is what we intended. Is it really going that way? And how will you respond if the goals are not met? And how will you respond if they're met? And so, Yasmina, I will turn it back over to you. We have a few closing slides, and we won't read them word for word, but we do ask if you can share one thing that you're taking away from today's session in the chat box. And also, we want to thank you for attending, and also let you know that you will receive an email once this webinar ends, and it will have a survey. And we ask that you please take time to complete the survey, because it allows us to report this information back to our funder, but also allows us to see the things that work well for you, the things that we can improve on, the things that maybe we should consider not doing anymore, but it gives us feedback on how we can improve and also allows us to continue to provide this service and these trainings and these webinars free of charge. And Yasmina, I will turn it back over to you.
Whew, I just feel like I finished a marathon. Oh, this in an hour, we were like, I don't know if it can be done in 4 minutes to spare. So we realized that there is not a lot of time for questions. But I am seeing the thoughts coming in about what they learned. A lot of people love the pause. And equity begins with me. Thank you, Suki. If you want to go to the next slide. If you're thinking to yourself, oh my gosh, I have a million questions and there are only now 3 minutes left in this presentation. So you have to get lunch, get on with your day. Good news, Time with Us is free. And you can request training and technical assistance by going to that link there. And you can tell us a little bit about what you need, a little bit about what your challenge is, and it will be triaged and you will be connected to someone who can at least point you in the right direction. We're not the experts on your community. I want to stress that. You are the experts on your community, but we can help you to connect to tools and supports to help you in this work. It can be isolating, it can be lonely, but it can be so rewarding and necessary. Laura, yes, I will ask Joanne to get me a copy of this chat and I will make sure to get your name down and send it to our colleague. Oh, there we go. Tanisha's got it. Thank you, everyone.
Yes, if you're interested in the bold conversations, please send an email to the intact.info@cars-rp.org slide. The email on that slide, on this slide, and just let us know that you're interested in it, and we'll make sure that you receive the information when we open the next cohort. We just opened applications and we just closed application period for September 2021 cohort. So, but our goal is to provide future cohorts. So just send us an email and we'll make sure you receive the next application information regarding the next application period.
I'm going to stop the recording and wish you well. I will be here with Dr. Freeman Foster for a 5-minute after party. If there are any burning questions, concerns, or if you want to just tell me you hated it, that's fine. I'll be here for 5 minutes.